Welcome to Heart, a podcast about all things heart-related, presented by the physicians of Advanced Cardiovascular Specialists. I'm your host, Susan Curtin. Our hope for Heart to Heart is to meet you where you are with valuable information from trusted experts in the field of cardiology. Today, we're talking with Dr. Trey Baucom. Always such a pleasure, Dr. Baucom. And we're talking about remote cardiac monitoring in patients with heart failure. So can you tell us about how remote cardiac monitoring is being used in patients with heart failure?
Absolutely. It is another exciting area of healthcare. We have devices that can monitor the rhythm of your heart. And those are both active devices that pace your heart, can shock your heart back to normal rhythm, and also some passive devices that just monitor the rhythm of your heart. And early on, they started building in some technology, particularly into the pacing and defibrillating devices that could detect congestive heart failure. Now, we also have devices that we can implant just to monitor congestive heart failure, but more commonly, it's a device that does something else therapeutic for you, like pace your heart or resynchronize your heart, or as a defibrillator. But it is capable of monitoring your heart in such ways that it can give us some early warning when you start to go into congestive heart failure, because there's a lot of overlap between people that have a device in them who also have congestive heart failure. And so they do give us a tremendous amount of information back on the patient about what's going on.
And how does this change the way they receive care?
Well, sometimes we can actually call them and say, we're worried about you. It looks like you're retaining fluid. Maybe you ought to come in and let us check you. Or at the very least, let's monitor you a little bit more closely for all your other vital signs and statistics to see if the device is correct. I mean, it's one piece of data, but a lot of times it's an early warning device so we can head it off before the patient gets sick and certainly before they go in the hospital.
So you can monitor, they're at home and you can see what's happening with them at home.
That's correct. This is all remote. This is done through our office. The signals are sent through a device near their bed usually. So it downloads information into that transmits to us, we look at it, and then if they're getting in trouble, we can tell that early on. And that's both with rhythms and congestive heart failure.
That's amazing technology, isn't it? Now, ACS has an on-site heart failure clinic, right?
That's correct. I mean, heart failure is an enormous problem in the United States. I mean, it's one of the number one reasons people are admitted to the hospital. It's multi-billion dollars a year in healthcare in the United States. And it's very prevalent in the South. Unfortunately, we have a lot of congestive heart failure down here, so much so that we now have a dedicated team that just treats congestive heart failure. We have a dedicated nurse practitioner and a dedicated registered nurse that's all they do is run a separate congestive heart failure clinic. And it's very beneficial to the doctors like myself because once we start someone on therapy, it's difficult for us to see them back every week like they often need because we have new patients coming in all the time. But the congestive heart failure nurses then coordinate their care as they titrate up their medications. They can actually give them IV therapeutic medications in their clinic, which is just upstairs in our office, and also do a lot of the remote monitoring and education on diet, salt intake, what to look for, that sort of thing. So it's very beneficial to the patients, and it helps keep the patients out of the hospital.
I mean, this is groundbreaking work on how patients are managed.
It is, and it's an enormous benefit to our patients to have this available.
And it allows us, I guess it allows you to recognize potential problems earlier due to this constant care, and you can monitor it and create some individualized plans, right?
Absolutely. They're very good. I mean, they have, since that's all they do, and they see the patients more frequently, they can titrate the medications very accurately. They can kind of see is the patient too dehydrated, should we back off the diuretic, should we go up on the new medications like Entresto's, a new medication. They also help us with the remote monitoring because they're the ones that really contact the patient by phone, talk to them, say, is everything going okay? Can you weigh daily for me for a while and we'll see what you're doing? And then I'll see patients in my office who aren't doing well, and I'll send them upstairs to get IV diuretics, which will help keep them out of the hospital. And particularly during COVID, we learned anybody we can keep out of the hospital is beneficial because we don't want them to go in the hospital and get sick with something else.
Right.
And patients prefer that. And so it's doubly beneficial.
And are you able then to coordinate with other specialists, like, maybe their PTs or?
Oh, absolutely. They also help with cardiac rehab and our advanced therapeutics. Like we have several patients that have semi-permanent artificial hearts, and they help us monitor those patients. And so they do a lot of that sort of work with us, and also coordinate with referral centers. If we do send someone out for an artificial heart called an LVAD, they help coordinate that care.
So what's the overall impact that you have seen on patients who have done this?
Well, they do better. I mean, that's just in a nutshell. Yeah. Their quality of life is better. They have fewer hospitalizations, fewer exacerbations of the congestive heart failure. These women that work in our heart failure clinic are pretty strict. And so if you do what they say, generally you'll feel better.
Well, I know that you have some of the most compassionate and knowledgeable nurses there. I mean, it's a great team.
Well, thank you very much. We're proud of them.
Yeah. And they form relationships with patients, don't they? I mean, they get to know their history. They get to know their stressors.
Absolutely. They know all about them. And it's always amazing to me. They have lots and lots of patients, but I'll call them and ask them about a patient just cold, and they'll know all about them every time. So they do a great job.
I think it can mean the world in a patient's recovery, knowing that they have that kind of support system there as well.
I agree.
Yeah. Well, thank you so much, Dr. Baucom.
Thank
Fascinating
you.
information. As usual, visit acsdoctors.com to learn more or to schedule an appointment.